Is there a certain age that's a requirement where you might age out, like you're too old for a hip surgery, or even in terms of weight? What are the age and weight requirements?
So we'll start with age. There is no age, and we kind of went through there that there's different reasons that patients have hip replacements. Um, I think the youngest patient I've done was 25, and the oldest hip replacement I believe was late 90s. And it's the patient's function. How are they functioning? Their medical health. And so we have to balance that is, will you be able to get through the operation and also the rehab afterwards? And um, any good surgeon will tell you to exhaust non-operative care before an operation. But once that operative state sets in, we have the discussion of what we need to do and how we would proceed with surgery itself.